state. Take a listen.
Thank you for coming today. We're here. My name is Rich Fitzgerald, County Executive. We are here to talk about that we have confirmed there were 2 cases here in Allegheny County of COVID-19. Dr. Bogan will be talking about that in more detail. We have our support here again from AHN and UPMC, which have been tremendous partners. I want to thank Dr. Parker, Dr. Yealy, who are here as well. They were here the other day at the EOC talking about what went on. Even in the last couple of days, we know some of the changes that have been made about our schools being closed for the next two weeks, visitation at our nursing homes, gatherings of 250 people or more being restricted. I also would like to acknowledge and thank, I see Congressman Lamb is here with us today, but I want to thank our congressional delegation, Congressman Doyle, Congressman Lamb, Congressman Reschenthaler, and Congressman Kelly, who last night passed in the U.S. Congress some relief for some of the folks that are going to be dealing with this issue in the coming days. One of the big things, obviously, is you're giving people, for companies that are under 500 employees, 2 weeks of paid leave, paid sick leave, adding $500 million to the WIC program, $400 million for Food Bank for people getting through this, and some other initiatives around FMLA and other things, as well as continuing to invest in improve it. The other thing that obviously is very important is testing. The testing will be provided for folks who have insurance. Will be getting tested, and even people that are uninsured will be provided testing at no charge. And again, I want to thank our folks for doing that. We certainly encourage our friends at the Senate to take that up and get that moving in a good way. With that, let me turn it over to Dr. Bogan, and she can go into details about the confirmed cases within the limits of HIPAA and privacy and other things like that, to talk about where we are at this point. Dr. Bogan?
Good afternoon, and thank you. As the county executive has said, we do have 2 confirmed cases of COVID-19 in our community in Allegheny County. The individuals are both adults, one in their 70s and one in their 60s. Neither has been hospitalized, and both are currently in isolation at home. The individuals are both city residents that reside in the same household. At this point in the Health Department's investigation, it's believed that both acquired COVID-19 during out-of-state travel. In order to protect patient privacy and confidentiality, additional information regarding these cases cannot be released. We have begun a contact investigation. Officials have and will continue to follow up with all individuals identified as close contacts of the 2 known cases and will enforce appropriate quarantine measures. Knowing that many residents are likely to be concerned about potential exposure or interaction with the 2 cases, the Health Department would like to remind the community that COVID-19 can only be spread through close contact. While at this time, no evidence of community spread in Allegheny County, the Health Department anticipates additional local cases in the coming days. We'd like to reiterate current guidance and recommendations that are designed to minimize the potential for the virus spreading in our community. Specifically, residents and organizations throughout the county should follow these proactive mitigation measures: suspend large gatherings, events, conferences of 250 individuals or more, avoid traveling to recreational activities like gyms, movie theaters, and shopping malls. Health Department officials are also encouraging religious leaders to exercise discretion in order to mitigate the spread of illness. We continue to consult with government and non-government partners throughout the county and will modify these recommendations as appropriate to protect the health of the public. The Health Department continues to field many questions regarding COVID-19 testing in Allegheny County. The Allegheny County Health Department is not currently testing for the virus. However, the Pennsylvania Department of Health, state laboratory, and commercial laboratories are performing testing. Healthcare providers are reminded that they do not have to receive approval from public health agencies such as the Pennsylvania Department of Health and the Allegheny County Health Department, and can submit specimens for testing through commercial laboratories. Over the past month, the county has received hundreds of calls from concerned citizens about potential illness with COVID-19. And up to this week, very few individuals were approved for testing at the state laboratory, given limited testing capacity and the stringent CDC guidance. However, within the past few days, that guidance has been relaxed, and as a result, the Health Department expects there will be expanded specimen collection availability over the next week. As of this date, the Health Department has submitted specimens from 26 county residents for testing by the state laboratory. This number is not inclusive, and it does not contain tests submitted to commercial laboratories. An important reminder, the following proactive hygiene measures are strongly encouraged to help stop the virus from spreading in our community. Wash your hands frequently with soap and water for at least 20 seconds. Cough or sneeze into your elbow, not your hands. Frequently clean highly touched surfaces, and please stay home if you're sick. If you have symptoms consistent with COVID-19, which include fever, cough, and shortness of breath, please stay at home and contact your primary care provider to determine if you need to be tested for COVID-19. If you don't have a primary care provider and are not sure if you need to be tested, please contact the Health Department number 412-687-2243. If you need to seek immediate medical care, please call 911 for assistance. If you are considering going to an urgent care center, an emergency department, or your doctor's office specifically for COVID-19 evaluation and testing, please call ahead to allow the staff at these locations to prepare for your arrival. We will continue to communicate with the public as more information is gathered. For the latest information on COVID-19, visit our website, subscribe to Allegheny Alerts, and follow the Health Department on Facebook and Twitter. Thank you.
We'll open up on any questions, including some of the other individuals here. We have Chief Braun from 911 Emergency Services. County Manager McCain is here as well as my Chief of Staff, Jennifer Liptak, among others, again, from our friends from AHN, and including Dr. Tom Campbell, also here from AHN, and our friends from UPMC. So.
Well, you don't do the testing. You obviously aren't tabbed all of the places that are doing it when you're doing it as well. There's been talk of, in other states too, happening on drive-through centers, pop-up testing centers. You mentioned very few have been happening before. Now with the relaxed rules, more are going to happen. Can you be more precise on how few had happened and now how fast you expect it to ramp up between the likes of UPMC as well as Westside and states or anyone else that might be involved?
So I'll take that first. So that's on the table, I think, for us at AHN, absolutely, to look at that capability. And we started those discussions, as I said the other day. We've been planning for this for 2 months. And the fact of the matter is we started to take that very seriously last week, especially because we've seen this to be an effective strategy in other countries. And certainly they've started to do it out west. So it's on the table absolutely for us.
Hi, Dr. Don Euly from UPMC, and thanks for the question and thanks for everybody being interested. I think expanded testing is necessary. It will take time to marshal all of the up-ramping of testing availability. And being tested is really two separate actions. You have to think of it. It's an acquisition of the specimen and then the physical testing of the specimen. And we have to recognize two different things. We want to be sure that people, when they have the specimen taken, it's not only safe for them, but it's safe for the person acquiring the specimen. And that's why we've opened, beginning on Tuesday, will be the Southside Center at UPMC. We're also planning for the same type of easier access testing centers, but we're starting with one that's safe and able to accommodate folks. And then separate from that is increasing the ability of the tests. That's happening not only at the state level, but also through private vendors, and UPMC is introducing its own test. So you got to think of those as two separate things.
You mentioned like maybe you could do 20 a day. How many, with everyone collectively working together, how many cases can you start testing a day?
Well, I think each capacity is going to change almost daily as the tests advance and the materials for the tests advance. So 20 a day is the day one estimation at the UPMC site alone. I suspect by the end of the week it'll be much higher than that, and all of them, including the private vendors. So I couldn't give you a precise estimate that in a week they'll do X amount per day. What I can tell you is that the availability will increase. That does not mean that anybody who has the idea that they want to test will still be able to get it. They still require some interaction with a physician, and through our mechanism, screening with IP and infection prevention specialists, because there is not universal access yet. I suspect it'll grow and grow and grow, but it will take time.
Can I also, I just want to comment that we are working on keeping the Allegheny County Health Department website up to date with locations for where you can get that testing done as it or the sample collection performed as that becomes available. So UPMC and AHN have both agreed to let us know as they open sites, so we can keep that website up to date with one place where all of the sample acquisition will be available. And again, that we expect to change on a daily basis.
And right after, Dr. Yuli, not long after your tour on the South Side, and I'd like to hear from Dr. Parker too, Cleveland Clinic and University Hospitals in Cleveland, two rival systems, sent out a press release. As you probably know, Cleveland Clinic had their test up and running as of Thursday, just a couple days before. And starting this morning, they have drive-through testing with anyone with a doctor's order for both university and for Cleveland Clinic. They're cooperating. The long press release quotes from both of their CEOs talking about how cooperation is important right now, and that they're going to utilize Cleveland Clinic's lab to do it. Are you all talking to each other, and do you plan anything like that since you have the capability, but you both have lots of patients here in Allegheny County and the surrounding area?
So I think that level of cooperation actually already exists, and I expect it to grow even further. Dr. Campbell and I have known each other for 36 years here in Pittsburgh, delivering emergency care. So we have a long and pretty healthy relationship. There are two aspects to that. One is we all have access to the state testing and to the private vendor testing, and so that cooperation already exists through that. Secondly, the new UPMC testing requires a physician to have requested it. It does not specify what type of physician that is. Obviously, the second is when that physician calls in, there'll be a UPMC infection prevention expert to help screen to ensure it's still appropriate, but there is no restriction on which type of physician makes the original request. So I think we're getting to the heart of your question about that. Does not.
Yeah, and I think we want to cooperate as everyone ramps up their testing capability. Whoever can deliver it the quickest with the largest volume and capacity, I think it's important for us to work together to make sure we can deliver it to the community, right? Because otherwise, we don't want to leave anybody in the community, insured, uninsured, without the potential to have them be tested.
When was Allegheny County made aware of these two cases? And secondly, how many people in Allegheny County are being tested?
We were made aware of the cases late last night, late Friday night. And I'm not sure I understand the second question. You mean?
How many people in Allegheny County are currently being tested for coronavirus?
So, related to the cases or just in general? In general. So, I think that Dr. Bogan mentioned that 26 people have had specimens sent to the state lab. However, there have been a lot of people who have been tested by commercial labs, and we do not necessarily get those results unless they're positive, so we don't have an exact handle. We're trying to get the commercial labs to also send us the negative so we can keep track of the number of tests, but we currently don't have that. Thank you.
Can you say how many samples are currently pending? I mean, 26 are being tested, but I'm sure there's a lot more waiting to be sent to the state lab.
Yeah, I don't have the exact number of pending. Thank you.
Your name?
Sorry, Kristen Mertz, a medical epidemiologist at Allegheny County Health Department. Thank you.
I just want to clarify, so uninsured people can still get tested for free?
Well, what Congress, maybe I'll ask Congressman Lamb, that our U.S. Congress, the House of Representatives passed that, but it has not passed the Senate as of yet.
That's correct. So the money that we appropriated last night and in our first bill is designed to make it so that anyone, regardless of whether they have insurance or not, will not pay for their testing. We expect that to be signed into law hopefully on Monday when the Senate returns and the President gets it at his desk. But we don't know exactly when that will become official. But that is the intent for anyone out there, whether you are insured or not, regardless of which type of insurance you have, whether you're on Medicare or Medicaid, you will not be charged to get this test if the symptoms and criteria are met that you should get it.
What if you're visiting from another country, can you still get tested here under that same legislation that you're pushing?
I don't know that our legislation clarifies someone visiting from another country, so I'd have to get back to you on that. It is designed for the protection of people who live in the United States.
Yes.
Can you give any more details? I know, like, you can't say that, you know, their names, but like neighborhood or where did this couple land or anything?
We have decided, we did discuss that, and we have decided that for patient privacy, it's best not to provide that information. The more information you give about somebody and their circumstances, you can pinpoint that because people know each other. Pittsburgh is a small, big town.
You think they're around in big public places where they might have infected others?
So we are not concerned about that because casual contact does not put you at risk. And want to be clear that, passing someone on the street is not a risk factor for acquiring the infection. And so casual contact is not. So people who are at risk, who we deemed at risk, are being notified and being screened and followed.
But still, you're asking people not to go to the gym or the mall and also why 250? Why not 249?
It's a great question. That actually is what the Department of Health has put out, and so we are being consistent with them. I think people are using lots of common sense. I know the University of Pittsburgh just put out new guidance that says gatherings of 25 or more are being discouraged. So I think that is a fluid number that will change over time. I did not personally pick. Do you know of any data where the 250 comes from? No. So I think it's really to discourage large gatherings.
Can you confirm that the two cases were not linked to nursing homes or senior living facilities?
Yeah, so the question is, was the cases linked to senior living facilities? And no, they are definitely not linked to those facilities.
Dr. Bowman, I'm sure you have read over your career or know well the 1918 flu. And specifically, I've read a couple stories this week really insightful about what happened in St. Louis, which was a model case. They had very relatively few cases, in particular few deaths. And what all the stories I've read say is that the head of the health department there took drastic action early and ordered churches and synagogues and other public places not to have gatherings. Very early in the crisis. And when you compare it to even Pittsburgh, where many thousands more who died here, for example, in 1918. Do you have the power, does the county have the power through the health department to do something like that? And have you contemplated doing something like that other than these, as you said, fluid guidelines about what should or shouldn't happen?
I think you know that I am new on the job. And I have some expertise behind me for people of what is the authority of the county. Is there somebody here who would run?
Andy, with the county solicitors here, would
I'm sorry that I am. Andy, come on. The question is, what is the authority for the county health department to ordering to get things shut down?
I mean, we're not. So there is legal authority within the county health department under the Local Health Administration Act regarding the abatement of nuisances. So pretty much because we're not at the community spread point at this point, and because the two cases we have are known travel-related cases, we're not at the point yet where that authority would be triggered legally. If we ever do get there, we're obviously prepared to undertake those actions.
So for a community spread case, you could order that no gatherings.
I think what we're going to do is
No school activity, no meetings.
What we're going to do is consult with medical experts to determine whether we think those measures would be appropriate.
I have a question. Can you tell us where those two individuals who tested positive were tested and treated? What hospital? What facility?
I can tell you from those patients were treated in one of the Allegheny Health Network emergency departments, and they did exactly what we're recommending. They were tested by their primary care. They spoke with their primary care physician before they were directed in. So we had ample notification. We had met those patients who came in their own private vehicle before they got there, had a mask in place. They were able to be assessed and very safely cared for without any excess exposure. And as you heard, they were both discharged. and we're going to be followed for additional symptoms.
And then a question probably someone else would answer, just with it being St. Patrick's Day, and I'm sure a lot of people still hitting the south side tonight, just maybe a message to those people who still want to go out and party tonight.
I would encourage social distancing, so no hugging, kissing. If you're sick, please don't go to the south side. Stay home, please, please. I'd encourage restaurants to be sure they're cleaning their tabletop surfaces well with an antiviral cleaning thing. There's a list on our website of what those approved, EPA-approved cleaning products are. Make sure that you're washing your hands regularly, and if it's getting crowded, perhaps go outside away from the crowds. I mean, I do understand it is the celebration, so.
A message for the community. I mean, given the amount of panic and anxiety, people are wiping out everything imaginable in stores. A lot of people are really struggling with this. What's a message, just a general message? I think every day people wake up and it gets worse, or they hear more, and they're just waiting for this to kind of peak, and we don't know when that's going to happen. But what's your message for people who live in this entire region?
The good news is that for most people, this is not a severe illness, right? This is really a severe illness for the elderly and for people who have underlying medical conditions like cardiovascular disease, chronic lung disease, and things like that. So what we're doing is really trying to protect those people who are vulnerable. For most people, it's going to feel like the cold or the flu, and you're going to get over it, and your immune system's going to respond. And what we're doing by social distancing and keeping people home is really protecting the vulnerable populations in our community. And so remember that, right? So if it's a beautiful sunny day and you want to go out for a walk, go out for a walk. The air movement of outdoor activity is safe, and people should be able to walk around. It's really being careful not to expose the risk to those people who shouldn't be exposed. So again, I'm a pediatrician. Children tolerate this quite well. The problem is they also touch things, sneeze on people, and so they will spread the illness without feeling very sick themselves. And so again, that's the whole point of these strategies, is to protect those at risk. It's the same reason we strongly encourage flu vaccine for every single person in our community, because you're trying to protect those people who will not be able to protect themselves very well when they get flu. So it's to protect yourself, but it's also to protect others. And we're doing the same thing, but on a much wider scale.
Are you also allowing visitors in senior care centers, or making sure that?
I believe that was.
There were some limitations on that. I think that was put out, and that's statewide as far as senior nursing homes, places like that. So there are some limitations on doing that. They're restricting that, and I think limiting it to people that. People that are near death almost. I mean, people that are really, that they would be allowed to be visited by their close loved ones. But for regular visitations, that's been restricted.
There's been estimates as much as 100,000 people have this in Ohio, and there's been cases in Youngstown, not nearby. Do you think that, I'm just curious from a medical perspective and just the possibility, could there be, could it be that widespread here and us not know about it at this point? Some people just recovering from it, or can you speak to that?
Yeah, so the question is, how big could it be here already, essentially? How many people could be infected that we simply don't know about? And the honest answer is, I don't know. The difficulty with estimates is the vast majority of the population hasn't been tested. And they haven't been tested because either they don't have any symptoms or they're truly not infected. And secondly, we already talked about the availability of testing required a lot of ramping up. And so it was not practically possible to test everyone except for those who could benefit the most from the test. In other words, it might alter their therapy. So we don't know. We have done some surveillance using not only the tests that are available for patient care, but also some research laboratory tests that were available inside the University of Pittsburgh. And we have not seen a wide outbreak. Now, those are very limited tests. I can't tell you that 300 or 400 people as part of a different trial from this same community who also didn't test positive is ironclad proof that there's zero or very little out there. We just haven't seen that yet. There will be some more multiplication in our area. And getting back to the other question, this is the time it's okay to be a little afraid about this. It's not okay to be panicked and to do things that really don't help at all and don't protect you. Walking around in a mask is not really going to protect you. It may feel like that, but it's not going to be the real protection. So the bottom line is we don't know, and that's why you hear numbers as estimates, because no one really knows for sure.
Can you go back a second? You said about the testing, that you did some testing here, and you did your own testing, maybe not approved, or?
So we spoke of this earlier at the 10 o'clock press conference, is that there is a research team at the University of Pittsburgh that has the availability of testing for the COVID-19 virus specifically. It's not approved for patient care use, so in fact you can't use it for that. But they've looked at samples over the past few months, up to, I think it's about 300, but I'm not certain of the exact number, and hadn't been able to detect in this area any of those. It is not the identical test that we use in practice now. It's very, very close, and it's not approved for patient use, and we don't want to use something for patient use that doesn't meet the standards that all of us would expect from a test.
Given that some people are at a higher risk, are these labs prioritizing testing for people who might be, like you said, a higher risk, older people, underlying health issues?
Yes, that's exactly why the restrictions are you had to have been seen by a physician, and then also when we introduced the UPMC test, while there'll be a second infection prevention, there's not a ubiquitous supply of the tests available right now, so there has to be some prioritization.
You said this morning at the press conference that you had a patient that you suspected was positive. Have they been tested, or are those results pending for them?
I think you just heard about them.
Oh,
Dr. Ely, can you explain to the public why masks don't work?
So the purpose of a regular mask isn't really to keep virus from infecting you. It's to keep you from infecting other people. So the average person walking around not having close contact, it does not prevent entry of anything that small in. It just doesn't, that's not the purpose of the mask. And wearing a mask that is either ill-fitting or uncomfortable that makes you manipulate your face, not only doesn't lower your risk, but if you thought about it, it might actually increase your risk should you have come in contact with your hands and the virus. So in fact, it doesn't, it's actually paradoxical. Obviously, in close quarters, medical conditions, masks serve a different purpose, but that's not what the average person's coming into contact with daily.
This is probably a question for Allegheny Health Network, but the two patients went to West Penn yesterday based on the release you guys just put out, and they had their results that night. Is that the typical turnaround? Were they? It looks like they went to maybe the primary care and
So those two patients were actually tested through their primary care office and through a commercial lab. And then when those tests came back, then they were referred to us.
Okay. So when were they?
Earlier in the week.
Okay, perfect. Thank you.
That was not a 24-hour turnaround time for that lab test.
So what is the typical turnaround time for these labs?
If you have them in-house and you're actually running them, it can be between 4 and 6 hours. If you're sending them out to a facility that's close to you from a commercial perspective, 24 hours is typical. If you're sending to the state, originally the turnaround was 24 to 48. They're around 24 hours right now with no backlog.
So there could still be a fair amount of people quarantined at home waiting for their results.
And depending upon which state they're in and what volume of testing is being sent.
Thank you.
And what commercial lab? Quest.
I can just say that the results that we've gotten so far are 48 to 72 hours from Quest and LabCorp.
But these patients were tested through Quest.
They're tested through a commercial lab.
We don't know which one. And Dr. Bogan, it's almost 3 weeks, so Monday will be 3 weeks since Dr. Messinea, CDC famously said it's not a matter of if, but when. We'll have commercial spread in the United States just 3 weeks ago. Are we at that point down here in our region? We've had 2 in Allegheny County, we've had 1 in Washington County. Are we at the if not if, but when stage that we will have commercial spread?
You mean community spread? That's okay. So the question is, are we at the stage of community spread? Kristen, what do you think about that? Are we at the stage of community spread?
Well, so far we don't have any evidence of community spread. It's not to say that it's impossible, but we haven't seen clusters of unexplained pneumonia. We haven't had any positives except for these two, and these two were acquired out of state. So at this point, we don't have any evidence of community spread, though it's not to say that it's impossible that it's occurring.
In relation to that, Dr. Parker has told me that AHN has not seen any surge in influenza cases, people coming in complaining of those kind of symptoms. Dr. Yuli, is that similar for UPMC? Have you not seen similarly a surge, or has it been a normal season, relatively speaking?
We're still at the plateau of influenza season, and I suspect that my partners across the river are experiencing the same thing. So influenza began to peak up early January, and it has flattened off for a period of time, but flattened off at a fairly high level. It's not really coming down yet. That's the trouble with the coronavirus being, or this COVID-19 illness being introduced now, is that it's coming at a time that a lot of other infections, particularly the flu, are also still hanging around. I would describe this as a fairly normal flu season, and it's still ongoing. So that means there's a lot of activity. The concern about COVID-19 illness has raised contacts to the emergency departments, the healthcare systems, but the actual numbers of patients have not yet become unmanageable. The concern is what we're here to help educate people about and manage. Call someone, log online. We have an online system called UPMC Anywhere Care. There are other platforms available. Get the information before the fear and the panic consumes you.
I was going to encourage, we are, the availability of telehealth in our community has really ramped up in the last few months, and so both AHN and UPMC have robust capacity for telehealth, and so that is a wonderful option for people because it keeps them out of the emergency departments and urgent care centers. So I would strongly encourage people to use those options if they have concerns.
Can you say what state they came from or where they were traveling?
I'm not at liberty to give that information.
Have these been confirmed by the CDC yet, or are they still technically presumptive positive?
No, they're confirmed not necessarily through the CDC, but they are considered confirmed cases.
You've been listening to Allegheny County health officials give an update on the COVID-19 cases here in our area. Right now, they're telling us that they have 2 confirmed cases, 2 adults, one in their 60s, one in their 70s. They both live in the same house. They got the virus from out-of-state travel. Right now, they're being quarantined at home, and they both live in the city. Health officials tell us they found out about this late last night. Again, they are telling people to avoid gyms, churches, and movie theaters. So if you feel sick, stay home, and officials are reminding everyone that the virus is only to be spread through close contact. We will have much more coverage from this major announcements on the first 2 cases of the coronavirus in Allegheny County coming up tonight at 6 and anytime on WPXI News app.
This has been a special report from Channel 11 News.